Which of the following chest radiographs is normal? And one thing to note when you're interpreting graphs such as these is that the black parts equal air. So black equals air. And then anything else should be white. So white could be normal. It could be the actual organs themselves, such as the heart appears white, or maybe if you pick up any bone from the ribs. But generally, sometimes when you see white where it shouldn't be, where you should normally have air, such as like a black part where air would be in the lung, then this would be abnormal depending on the situation. So we'll discuss as we go through each of these options here. So option A, when you take a look at option A, you'll note that there's these white flaky areas here where they shouldn't be. Normally it should be completely black and just air in the lungs. So in this image, these are known as pulmonary fibrosis. So pulmonary fibrosis. And this is showing that this is not a normal structure because the lung is not completely clear and it's hard to distinguish exactly where the heart is located in this example. So option A would be abnormal. Option B, we could see that there's a lot of abnormalities. Also, as a note here, we could see this patient has a pacemaker, which has nothing to do really with the radiograph itself. You could have a normal chest x-ray and they just happen to have a pacemaker, but just so you know what that is. But we can note that there's lots of white here. So all of this where the lungs should be clear and there should be air, all of that is taking up space in this radiograph. And we just see this one single lung here where it's just black air. And that is because in this example, it looks like they have a pneumothorax or a collapsed lung, and that's showing that this lung is not inflated the way it should be on this whole side for this patient's radiograph. So therefore, we can eliminate option B. This is not a normal radiograph. Taking a look at option C here, this would be an example of a normal radiograph. We could see that these lungs are nice and clear. It's all black there. And we could see a distinct outline of where the heart is located there. So this would be an example of a normal radiograph. Option C would be correct. Option D, unfortunately for this patient, we could see that this would look like metastatic cancer, which has spread all of these parts here where it should be clear or have overtaken in this patient's radiograph. So this is incorrect. This would not be a normal radiograph. This is metastatic cancer. And then option B, we were saying, was a pneumothorax or a collapsed lung. So the only normal radiograph here would be option C.